As of May 6, 2020, CDC.gov has reported 44,016 deaths related to COVID-19. If we had enough and sooner vaccines, less people would have died. But why not? Because manufacturers in the United States has very little protection against lawsuits from the government. Unfortunately, the government is not producing enough vaccines or infusing new technologies to develop vaccines. And this has left that we do not move forward with research on new vaccines. Liability issues has left this an unprepared pandemic. The government should either produce enough vaccines or allow and protect manufacturers to research and develop new vaccines, or join forces. Through my research, I have found there are three main areas about research and development related to vaccines in the United States. First, we will talk about the urgent needs for COVID-19 vaccine. Secondly, we'll talk about the rules and regulations about developing vaccines. And lastly, we will talk about how the government should support manufacturers or join forces. Now, let's talk about the urgent needs of the vaccine for COVID-19. As you all know that the disease started in China and spread it to the US, and as of May the 6th, CDC reported 44,016 deaths. As you all know that we have to treat the disease with prevention, with diagnosis, and with treatment. We do not have prevention because we don't have vaccine. We do not have testing. Therefore, we cannot have diagnosis, cannot have the adequate number of diagnoses. And lastly, we do not have sufficient treatment to treat enough patients. So how can we prevent this, to prevent less people from getting sick and prevent less people from dying? On April the 21st, 2020, OBP.org has an article called FAQ, Finding a Vaccine to Beat COVID-19. It talks about for infectious disease, there's an immediate need for developing vaccines, and unfortunately, it takes from 12 to 18 months to develop a vaccine like this. There's another article on CDC.gov on May the 6th, 2020 as well, called Interpretation of Cumulative Death Forecast. Even though the chart only displayed up to June the 1st only, the number is still going up. Now that we talked about the urgent needs for developing the magazine, we'll talk about the rules and regulations. In July 2011, there's an article called Ensuring the Safety of Vaccines in the United States, and it talked about the procedures about licensing for vaccine. There's first a pre-licensure procedure that involves the testing in the lab first. Once testing in the lab is passed, it will be tested first and only on the animals. Once that past that stage, we will go to the 3 phases clinical trials. For instance, children's medicine will be tested on an adult. So the phase 1 is tested on 20 to 100 healthy volunteers. The second phase is tested on hundreds of adults. And lastly, the test is done on hundreds to up to thousands of adults. The next stage is called the post-licensure. It is monitored by CDC and FDA scientists, and there's a system called the VAERS system, which stands for Vaccine Adverse Event Reporting System. And using the system, CDC has also have a data link, which is called VSD, that stands for Vaccine Safety Data Link. And these are all the measurements that scientists and the government use to measure the adverse events related to the vaccine. And lastly, the government will apply very strict rules and regulations on manufacturers in terms of manufacturing the vaccine. Lastly, after we have talked about the rules and regulation, let's talk about how the government should loosen the rules and regulation to support the manufacturers and protect them from the liabilities. So why don't we let the government control it? Let's look at an article that was published on February 6, 2017 called The Long Shadow of 1917 Swine Flu Vaccine Fiasco. And it was published on the Smithsonian magazine. It has mentioned about 450 odd people that has got something called the Guillain-Barré syndrome. That is a rare neurological disorder. As you can see, government-approved vaccines can also cause side effects. So why don't we use the private sectors? On April the 17th, 2020, there's an article on USHHS website called the National Institute of Health to launch public and private partnership to speed COVID-19 vaccine and treatment options. In this article, it talked about the NIH director, Dr. Collins. Dr. Collins mentioned that we need to bring the full power of biomedical research enterprise to bear on this crisis. In the same article, Dr. Dalston from Pfizer, president of Pfizer, also talks about this potentially powerful NIH initiative may allow us further accelerate the delivery of much needed therapies. So there's an article on healthaffairs.org published on March the 21st, 2019, that is titled Vaccine Exemptions and Federal Government's Role. It talked about the PHSA Public Health Service Act Section 331. It talks about the United States surgeon is authorized to make and enforce such regulations in his judgment are necessary to prevent the introduction, transmission, and spread of communicable diseases from a foreign country with the approval of the HHS secretary. However, Section 331 also says that it forbids any regulation supersedes state laws. As you can see that we have a hard lesson that we have learned. So many people have died. The government should either manufacture more vaccines, allow private manufacturers to develop vaccines and protect them from liabilities, or join forces. There's a long way to go. And I hope that the government has learned a lesson so that less people will die.